By far and away, the main causes of facial skin cancer, or the main cause, is UV exposure, so sunlight. A lot of my patients will tell me that they're not sun worshippers. That is, they don't go on sunbeds and they don't lie out on the beach for extended periods of time, but you don't have to be that kind of person to get skin cancer. We're all exposed to sunlight, and it's the cumulative exposure over our lifetimes and also recurrent episodes of sunburn. There are other rarer causes, so certain genetic conditions that predispose people to develop certain subtypes of skin cancer, but by and large, the one thing that people need to bear in mind is sunlight exposure and taking every measure they can to protect against that. So the main associated risk factors, as stated, is sun exposure. If you have already got pigmented lesions, moles, which may be atypical, then that puts you in a slightly higher risk category. If you're particularly fair-skinned, like I am, then fairer-skinned people, we're not genetically engineered, if you like, to live in environments with lots of sunlight. So we tend to do a lot poorer, tend to burn more easily, and tend to acquire the harmful effects of UV radiation a little easier. As I mentioned in my last question, there were certain genetic factors that can predispose outside of that, so certain rare conditions like Gauling-Gault syndrome, and they're really, really uncommon. Patients are usually aware of their diagnosis before they come to me, but those are sort of the much less common risks for skin cancer. So avoiding it is avoiding skin cancer. The main thing is protecting yourself against the sunlight. So, for example, not choosing to be a sun worshipper, so not choosing to go on sunbeds or lay out during the hottest periods of the day in direct sunlight when you're on holiday, using appropriate factor sun cream, so SPF 50 really, for somebody of my skin coloration. Wearing a hat, as silly as it sounds, it's a very simple thing, but it keeps the direct sunlight off you. And so all these very simple measures will hopefully reduce risks. And the other thing is having an awareness of what to look out for. So having a low threshold to self-examine, particularly if you have lots of moles or pigmented lesions, you're looking for ones that are changing, behaving abnormally, the kind of ugly duckling mole that just doesn't look like the rest, and having a reasonable threshold to seek medical advice at an early stage. So there are different types of facial skin cancer. So there are non-melanoma skin cancers broadly, basal cell carcinomas and squamous cell carcinomas being the most common. And then there are melanomas. The melanomas tend to be more often than not pigmented lesions. So what we're looking for is moles that are behaving atypically, so that they're irregular, asymmetrical, where they have variable pigmentation throughout, as in they're not homogeneous and all pigmented the same. Maybe they're beginning to itch, maybe they're bleeding on contact, maybe they're changing in character, maybe it's the appearance of a new mole in adulthood. All those things are sort of worrying signs that make you think this is not normal and I should at least have a chat with my GP or a dermatologist about that. Non-melanoma skin cancers, so there are rarer types, but the common types, which are SCCs and BCCs, are really nodular type lesions often, or exophytic outgrowths with or without ulceration. So they're lesions that again are going to be growing, they're going to be bleeding on contact, they're going to be itchy potentially, and they're just new appearances and changing appearances over time. Regarding the concerned that skin cancer is life-threatening. So the commonest skin cancer I deal with is something called a basal cell carcinoma. The old-fashioned nickname for those was a rodent ulcer. They don't tend to spread, they just tend to grow locally and tend to get bigger and uglier. They don't tend to be life-threatening, but they can be challenging to treat and reconstruct on the face if they're left untreated for prolonged periods of time. Squamous cell carcinomas and melanomas are a different kettle of fish. They can tend to spread around the body, they can tend to behave much more aggressively, and they need to be treated in a much shorter time span because of this, and they can be life-threatening. However, there are some really good treatment modalities, ranging from very low-key treatment modalities like curettage and cryotherapy, all the way up to radiotherapy and surgery. And even in advanced cases of skin cancer, such as melanoma and some squamous cell carcinomas, there are now new medical treatments, immunotherapies and targeted therapies that have really revolutionized the survival and prognosis of that group of patients. So I think the bottom line is, if you've got a suspicion, seek medical advice early, get diagnosed early, because the earlier you're diagnosed, the easier treatment is and the more effective it's going to be. But we have some great options and a great armamentarium now.